Okay, so today we'll look at formation of urine, and we know formation of urine comprises of three main processes, which include filtration, selective reabsorption, and secretion. So we'll look at filtration. Filtration is simply the removal of unwanted toxic substances from the blood in readiness for excretion out of the body. It takes place in the glomerulus, which is semi-permeable. Water and some small molecules pass through, but some are reabsorbed. These include blood cells, plasma proteins, and other large molecules are too large to be filtered out of the glomerular mesh, hence they remain in the capillaries. The filtrate that remains in the glomerulus is similar to components of plasma, with the exception of plasma proteins and blood cells. Filtration takes place because there is a difference between the blood pressure in the glomerulus and the pressure of the filtrate in the glomerular capsule. This pressure is called this pressure is because of the difference between the afferent and the efferent arterioles. So the next process in the urine formation is selective reabsorption. In selective reabsorption, there is selection of the needed substances from the glomerular filtrate back into the bloodstream, which are needed for different body processes. Selective reabsorption takes place in the proximal convoluted tubule. Because the proximal convoluted tubule is lined with microvilli, which increases the surface area for absorption of many substances. Many of the substances that are reabsorbed in the proximal convoluted tubule include electrolytes and organic substances like glucose. The reabsorption can be through passive transportation. However, glucose is reabsorbed through active transportation because it is all needed back in the body and should not be seen in the urine. About 60 to 70% of the filtrate reaching the medullary loop includes water, especially sodium and chloride. Then 15 to 20% of the original filtrate will reach the distal convoluted tubule, which and most electrolytes like sodium are reabsorbed in the distal convoluted tubule. While in the collected ducts, there is reabsorption of water because there and as much as possible of water is reabsorbed from this filtrate. So substances like glucose are completely reabsorbed back into the blood unless if there is excess glucose levels in the blood. Hence, that's why we do not see glucose in the urine. Reabsorption of nitrogenous substances like urea, uric acid, creatinine is very limited. And there are certain hormones which are influencing the selective reabsorption, which include antidiuretic hormone, aldosterone, and many others. The last step is the secretion. Filtration occurs as blood flows through the glomerulus, and substances not needed like foreign materials such as aspirin and are not entirely filtered out. This is because of the short time the blood remains in the glomerulus. Hence, such substances are cleared out into the peritubular capillaries, going into the filtrate in the proximal convoluted tubules.